morning, everyone. On this lovely Saturday morning, I welcome you to this first inaugural webinar on COVID rehabilitation program organized by RAC Hospital. It gives me great pleasure to introduce our speakers today. But before I do that, I have a couple of messages from our Chief Executive of RAC Hospital and the Chief Executive of the Arabian Healthcare Groups, which we will be showing first, and then I will move on to the actual webinar itself. Okay, can we have the message from Dr. Raza Siddiqui first, please?
Welcome to RAC Hospital, ARISE UNDRR COVID Rehabilitation Initiative. As you are aware, more than 95 million lucky people who have recovered out of this deadly disease still face a lot of challenges. Medical challenges, physical challenges, nutritional challenges, and lot of other challenges. We have developed this program to bring you back to the normal life. I am sure by now all of you would have got your personalized prescription. But this prescription, as committed and promised, will be supported with online webinars consisting of medical talks, nutritional talks, physical therapist talks, some of the exercise guidelines, and yoga classes. In addition, every week you will get health tips which will help you in improving your lifestyle. It is my pleasure to welcome you to this series of webinars which will continue for a period of 1 year and more if required. We have selected a hand-picked team of doctors, nutritionists, lifestyle counselors, physical therapists, and yoga gurus. It will be our pleasure to provide you all this every week from now onwards for next 1 year. Welcome back to the new normal life and enjoy the webinars and take maximum benefit out of it.
Thank you, Dr. Raza Siddiqui, for the introduction to the actual program. I would now request the message from Dr. Gaur, who's the Chief Executive Officer of RAC Hospital and also our consultant surgeon at the hospital, to give his message, please.
RAC Hospital is a tertiary care private hospital in the Northern Emirates that has rapidly achieved a reputation for quality healthcare. Since the onset of the COVID pandemic, we at RAC Hospital have passionately tried to mitigate the sometimes very severe consequences of the disease. Fast and precise PCR testing, determination of antibody levels, and even therapy with monoclonal antibodies, not available anywhere else in the region, are typical examples of how serious we have been trying to keep our patients and staff out of clear and present danger. All these measures, however, are elements to be done in the acute COVID care. There is no structured approach to take care of patients who have been affected by the virus and suffer, sometimes for long periods of time, from sometimes severe post-COVID symptoms. Symptoms that can affect not only your physical well-being, but can also have serious repercussions on your mental strength and stability. It is with great pride that we have now introduced the post-COVID rehabilitation program. It is a structured online program comprising of individual assessments and advice, specialized webinars, and tailored information free of cost, accessible to everyone, anytime, around the world, designed to guide post-COVID patients to heal and recover as well and fast as possible.
Thank you, Dr. Gaur, for a very clear message as to why we're doing this. And without taking too much of our time, I would now like to introduce our two speakers, one after the other. The first one to be talking about today's webinar and the plan for the involvement of senior doctors over the coming year is our own medical director at RAC Hospital, Dr. Shweta Adashia. Dr. Shweta is a neurologist by profession, having trained in India and in the UK, in Cambridge, in fact, where she was before she joined us again. Dr. Shweta is as I said, is a neurologist with experience of working in many countries, including South Africa, Canada, in the Middle East countries, of course, in the UAE and in India before that. She has multiple presentations to her name, and she's also a TED speaker, and she speaks on the impact of story on the brain. She's used to be a table tennis champion. I think we should ask Dr. Shweta to tell us if she still plays table tennis. And she is an avid traveler. That's the other interest that she has. She's conducted over 200 workshops in various universities where she's talked about brain mapping techniques to the audience. Right. Without too much time, I would like to ask Dr. Shweta to uh, give her presentation, please.
Thank you, everyone. I am Dr. Shweta. As Dr. Said gave a very kind introduction, let us go straight into COVID. Now, we are all living currently in the pandemic. The pandemic is yet not over. Till date, we have approximately 122 million cases yet globally. It is not a virus which has just its limited boundaries. We are seeing the brunt all across the world. We all know that it originated in a certain province in Wuhan and then had been declared as a pandemic last year. We have almost completed a year into this, and that is how you and we are again connected in this recovery path together. This is a very important virus to understand because it's not just like any flu virus. There were so many myths and facts about it which got introduced in the first half when the virus was very new. Now it's not any more new to us. It is not just doing anything just like simple flu. However, most of the people, 80% of the times, do have fever, dry cough, shortness of breath, fatigue, sore throat, muscle pain. I'm sure one of you have also gone through this journey of what COVID is like. But 15% of these patients are also prone for being affected at various other organs. On your right side, you see all the way from head to toe, what are the potential complications which COVID disease can cause. Now, it is very important for us to be completely knowledgeable about this virus, not just we as doctors, but all of us as patients, as rehab specialists, as a team, because the virus is consistently dynamic. The virus is such a structure which changes its structure and form quite often. And that is what, when you hear there are X number of variants coming up, there are X number of mutants which are coming in. So being actually from the credible source, continuously updated about the virus is also one of the jobs, not just of a doctor, but of any community member or of a patient. And our job here with this program is also to make sure that we will bring in a series of different kinds of webinars, which will talk about each of the system affection with COVID. So what is it doing at the brain? Now we have to understand that it is going past, as you have been seeing, that the collection of the swab sample has been through the nose. Essentially, that is where the entry of the virus begins, which is the nasopharynx, and then it gets into the brain through the olfactory bulb. Olfactory bulb is nothing but the sense of smell. And that is the reason why you can have a prolonged loss of smell following COVID. Once it gets into the brain, it can definitely affect brain in multiple forms. Then it can affect the lungs, it can affect the kidneys, it can affect liver, it can affect the GI system. If you sort of swallow the thing and it goes into the stomach, into the intestine, it can have a myriad of symptoms. So every system is sort of prone to develop its complication. While, as I said, 80% of the times you will recover like any other viral weakness. However, fatigue can be long lasting. And that is the reason why I'm sure a lot of people would wonder whether this will ever go away, whether COVID is permanent, etc. and all. So it's important for us to know these implications. Now, there are some skin problems also noted with COVID. Initially, the toe syndrome, where the toe used to get bluish black in color, which was part of the COVID disease. And it has also been causing problems with sugar. Particularly diabetic population is prone to have these fluctuations when they get COVID. Now, it is very important to understand what really the virus is doing within the cell. Okay, it's very, very simple. If we just understand that it is not doing anything by itself, it needs a host. It needs to get into the cell of the host, which is you or me, whoever can get succumb to the COVID virus, and then it sort of starts multiplying or starts replicating. So essentially, it is not active unless it enters a host body. Now, who are the people whom it can actually have a havoc within the body? These are the proportions of people, particularly with heart problems, with diabetes, with chronic respiratory, which is lung issues, high blood pressure, people with cancer, and people who have been having some immune conditions where the immunity is not as strong to fight the virus. So these are the people who then gets into a severe form of the COVID or gets a prolonged time to recover from even a simple COVID with sore throat or cough. So this is very important to understand. Now, what is the spectrum? As I mentioned, that the spectrum is quite wide and still dynamically it's growing based on the mutants. 80% of the times it's mild, it goes away. In 13.8% of the times, it can be potentially severe or serious where you do need critical care, and the remaining 6% can be seriously critical with more need for the oxygen or more need for in terms of all the parameters to be stabilized, which is in the ICU. So most of you who have been or who are listening with us today here, remember that 80% of the times it's very mild, it will go away, and we don't need to worry about it. We just have to understand the process, how it is doing, what it is doing, who you can take help of, and how you can do the best to recover. These are the four fundamental questions which you and me have to ask in terms of COVID recovery. Now, initially, we had this whole bunch of frontliner workers who were part of the COVID war, who were part of this helping us out of this pandemic situation. Yes, of course, there were healthcare workers, there were some frontliners, but, and of course, there were some vaccine people, the quick sort of the availability of vaccine across the globe, making sure that we develop something called as antibody. And we will talk about a lot of sessions with vaccine and what happens post-vaccine, etc., in our forthcoming series of lectures. But who have been very critical and important to understand are the rehab experts here. Because once you get COVID, you have to make sure that you go back to your original self, not just physiologically, mentally, physically, and metabolically. So all the important parameters have to be taken care, and that can only happen with the expert help. Now, this is what the latest data has shown, that sometimes the recovery can take up to 3 months. We have been reading some vague things like long COVID. Yes, essentially there is a percentage of people who would take a very long time to recover. And these are essentially the people who can have a lingering symptoms. For example, the loss of taste, loss of smell, some sort of headaches, fatigue, confusion, brain fog, you don't understand what you're doing, some sort of anxiety, post-traumatic stress disorder, nothing but just some sort of lingering symptom which is bothersome in your daily quality of life. Now, we are all living in this world to just have the best quality of life, right? Whoever it is, the idea, final idea is that we should all be living healthily and happily. And whatever COVID sort of takes away from us, it is our responsibility to build it back again. So the three stages in the recovery of COVID is essentially you get exposed to the infection, you of course get to the hospital, you get the therapeutic help from whatever the doctor. The second stage is your body is slowly recovering. It can take up to 3 months. And the third most important stage is to maintain the milieu, which is your mental milieu as well as your body milieu, which will be in the following months post-COVID infection. Now, this is all the sequelae which I already narrated earlier, but just for common sort of understanding, we have to understand that headaches, confusions, some sort of anxiety or feeling of restlessness is common following COVID. Some heart issues like chest pain, palpitations, where you feel that the heart is beating faster, some sort of problems with kidney. Now, not that all patients develop this, but you could have one or odd symptom which can last beyond the COVID phase. There could be diarrhea, there could be some sort of skin changes, there can be thrombosis. Now, what is thrombosis? Is that your blood essentially becomes very thick. It becomes clotted and it can develop potential complications by causing heart issues or brain problems because of the blood being clotted. Mood changes, of course, sleep issues. I am seeing a lot of patients in my clinic currently, being a neurologist, Most of the focus for me has been into mental confusion, fog, brain fog, sleep issues, and it is common. So it is very important to understand that we deal with each of the aspects wherever the COVID has a potential route to enter and potential destruction, where we can tackle it even before actually some things are evident. So going after your recovery, perfectly understanding what is happening with your body is very important. Now some people have had all these problems about in one or single form, and which is also possible. It is possible that it is two or three problems combined together, and we are seeing all sorts of problems in our clinics. However, it is not that we need to be afraid about it. It is important to recognize it and then treat it. Now what is really the virus doing? How do you have a virus which is affecting all these sort of systems? The virus essentially is not just coming inside the host and replicating, but it is affecting your basal immunity or basic immunity, by which it is also inducing something called as cytokines. Now, cytokines are nothing but inflammatory markers. Inflammation means it is going inside and essentially causing a cascade of reactions in the blood, which can make the blood thick, which can cause problems with each of the individual organs that we are dealing with. Now it can directly, those sort of inflammatory markers can directly damage the brain. For example, if it's brain, it can be kidney, it can be liver, it can be GI tract, etc. So this is how it sort of covers most of the organs, and we have to understand as rehab experts or even as doctors to pay attention to each of your symptom. And essentially that is why you have this rehab scan put forth, which Professor Kennedy would talk about, which will go through a very rigorous and systematic review of each of the problems that you can potentially face. And the idea is that we can nip it in the bud even before it becomes a problem. So my last message is, let's not take it lightly. Let's get all the information from the credible resources. Take help from experienced people. Being positive during the whole time. There is enough talked about how positivity yields to good neurons, serotonin, dopamine, etc., and sort of good chemicals which get formed within the brain as well as the body. It is always psycho, neuro, physio, immuno, endocrinology. Again, I'll repeat it: psycho, neuro, immuno, physio, endocrinology. It always starts from the top brain and then sort of percolates down to each of your body organs. And that's why applying all the techniques, being positive and doing all the things the right way is very, very important. So I hope that your journey to the recovery is short, very much happy, and I wish that you get well soon. Now there is no stigma around any of the COVID problems. So we have to understand that we don't have to overdo things. We don't have to overthink. We have to seek the timely help and try our level best to understand and do it well. Thank you very much. And I hope we will be able to help in this journey over the forthcoming months and bring out all the essential topics related to each of the system, and very welcome to sort of pose any questions or concerns to us. Thank you again.
Thank you very much, Dr. Shweta, for a comprehensive talk on what COVID can do and how do we cope with this post-recovery. I think, as you mentioned, that there's a lot more detail that can be addressed. There'll be a lot of issues that can be addressed in detail, and we will plan to do that in the next few weeks. I will take questions from members of the audience at the end of the presentation, but before we do that, I would like to move on to the next talk, which is by Professor Adrian Kennedy, who's the Chief Wellness Officer of the Arabian Wellness and Lifestyle Management Group. He's a lifestyle guru and he's a rehabilitation expert. He has basically created the lifestyle and wellness program that allows in the corporate sector predominantly previously, and that allows employees to virtually manage their health and take responsibility for their own health with expert advice. Professor Kennedy has an academic background in business, health, law, and after his PhD from the United States about 40 years ago, he's been working relentlessly in this field of health and wellness in India and now in the UAE. I would leave the space for now for Professor Kennedy to talk about what the rehabilitation program is and explain to all of us how this is going to be useful to well, not just the patients who have recovered, but I think to the extended families and to the physicians who look after these patients. So hopefully with the complementing of the rehabilitation program with the medical treatment, there's a lot more to achieve. Professor Kennedy, please.
Thank you. Thank you so much, Dr. Naveed. And my gratitude, of course, to Dr. Shweta for presenting the medical aspects of COVID. My presentation basically deals with the lifestyle aspects of COVID. Now, one may wonder what lifestyle basically has to do with an infectious disease. Now, at this point of time, if we go back into the division of infection or the division of medicine per se into non-communicable diseases and infectious diseases, then we would see that with the Framingham study way back in 1950, we discovered that the cardiac ailment, which kills about the morbidity or the mortality ranges at about 50 to 60% worldwide, we discovered that there were certain factors that contributed to the cardiac ailment. And these factors, surprisingly, were an inappropriate diet, obesity, high levels of stress, low levels of activity, and of course, a family history. Now, all of these are non-medical symptoms, but nevertheless, they were a major causative factor in the major killer of people worldwide. And therefore, some of us from around the world began to think that there should be a correlation between the way we live and the diseases we have, and we should medically connect these things. And therefore, way back in the 90s, I recall that we sat with the Harvard Medical School and we created a correlation by running a series of seminars in several parts of the world, but I was specifically connected with the Asian continent. And we presented our concept to doctors of the correlation between lifestyle and the cardiac ailment. Now, I say this, or lifestyle and non-communicable diseases and the relationship thereof. I say this in view of the fact that COVID is an infectious disease. And yet, to my eye, it has amazing correlations with the way we live. The way we live is relevant to COVID. For example, living in large communities, living in surroundings that increase infection, having some system, suffering from low immunity, all of these are caused by lifestyle. Yes. And therefore, my concept is to correlate these aspects with rehabilitation and infection. Now, I must thank Dr. Shweta for the presentation she made earlier, which gave us all the information that is on this slide. We know that this started in Wuhan, China in 2019. We know that it is in a short space of 1 year spread across 219 odd countries. We know that it has impacted 120 million people. And we do know that more than 10 million people have died from this malady. We know this. We know these factors. Most immediately because of Dr. Shweta, we also know that 80% of these individuals would have light treatment at home and 20% would be hospitalized. And we know the great progress that has been made in testing and most recently within the last month or two on vaccines. So how is this virus spread? Amazingly, it is spread, not amazingly, but the major spread is between human to human. I'm frequently asked, can we get it? It originated from animals, so can we get it from our pets? The answer is very unlikely. Can you? Yes. But 90 to 99% of the spread in our current scenario is from human to human. And we've also discovered that there are certain individuals who have a higher propensity to fall victim to this ailment. And these are the risk factors. Now, these risk factors, as we know, is age. The older you are, the lower your immunity. The lower your immunity, the greater is your inability to cope with infection. So age is a factor. Now, would it be 50 or 60 or 70? Well, let's just say that the older you are, over 50, the higher your risk. We also saw from Dr. Shweta's slides that individuals with cardiac ailments, individuals with diabetes, individuals with respiratory problems seem to have a higher propensity of having a more serious malady. 80%, of course, will be treated from home, and this could be the young individuals who seem to have no comorbidities or very few comorbidities. But individuals who have hypertension, diabetes, hypercholesteremia, problems with respiration or renal problems or kidney problems, and individuals as a consequence who have low immunity will obviously have a higher risk of having a poorer or a more serious outcome. So risk factors is an important part, but that does not take away from the fact that community living is a major factor. So you could, where you live in large communities, you have a higher risk. And that is the reason why worldwide we created a parallel problem by creating the lockdowns and creating economic disruption for billions of people. And now we are having to find new ways. We are having to find ways of managing people working, but at the same time managing the virus through vaccines and other factors. So what are these factors that can support our day-to-day living where we can manage the virus? The rules are very simple, and these rules have been broadcast several times over by the WHO, by our very own national health associations and associations around the world, and they simply fall into 3 or 4 large areas. The first, social distance. Now we know that sneezing, etc., can spread the droplets to a distance of 1 or 2 meters. So therefore, obviously, you would like to keep a space of 1 or 2 meters between individuals. We also know that simple washing your hands with soap and water can reduce, can clean and disinfect your hands in case you happen to be in locations where large populations have been there with the lift or commuting through an escalator, or perhaps even walking in offices, working in offices, etc. And we also know that we need to wear masks, not only to protect ourselves, but also to protect others. Now, in my earlier slide, I mentioned that individuals who had comorbidities would have a more serious outcome, or there was a probability, a high possibility that they would have more serious comorbidities. We've also discovered, as we keep discovering new things on a day-to-day basis, we've also discovered that COVID is not simply an infection of 14 or 21 days. Well, it is true that you are positive for 14 or 21 days. It is also true that you are treated in the hospital or by our medical professionals for that period of time, after which you are negative. But what we have discovered is that the long-term impacts of COVID are almost as debilitating as the ailment itself. And Dr. Shweta's slide indicates that more than 70% of individuals who actually get COVID or who test positive seem to have long-term symptoms. Now, who are these individuals who would have long-term symptoms? Of course, we are talking about managing long-term COVID. So who is the category that would come into the management of this long-term COVID or rehabilitation. Certainly individuals with comorbidities, and those comorbidities, as Dr. Shweta has mentioned, spread across the entire body. You're talking about cardiac ailments, you're talking about respiratory ailments, and I will add to that, beyond what Dr. Shweta has identified, two other factors that we seem to have identified in the field of lifestyle medicine, and that is obesity and smoking and alcohol. Now, we did a study only recently, which was published, that indicated that individuals who are obese probably have the highest risk of suffering long-term COVID ailments. And we asked ourselves a question as to why this is the case. And the reasons are very simple. And those reasons are that individuals who are obese are individuals who have the lowest health quotient and are individuals with the lowest immunity. And therefore, there is a correlation between obesity and long-term COVID. We also notice a correlation and an obvious correlation between smoking and COVID. COVID, after all, is respiratory, originates as a respiratory ailment. And therefore, anything like smoking, for example, that impacts the lungs, that it impacts the entire circulatory system, impacts the cardiac system, will, of course, put you at risk for improving from COVID. And alcohol cannibalizes your entire nutrition. It results in malabsorption. It reduces the vitamins and flavonoids. It reduces immunity. So therefore, you have comorbidities that are not only medical ailments, but comorbidities that are also lifestyle ailments. And then what are the symptoms? The symptoms, as Dr. Shweta's slide has very amply certified, include exhaustion and fatigue. And exhaustion and fatigue, as I recall, covers about 38% of the population. I'm taking from Dr. Shweta's slides, and we are talking body pain, 50% of the population. You're talking about breathing difficulty, 19% of the population. But overall, if you look at it, all the other aspects, including the renal aspects and the liver aspects, you add all of that together, but go back to the original factor that 75% of individuals who have tested COVID positive will have long-term symptoms. So what do we do? Yes. Well, you have, of course, the picture at the side is a picture of our beautiful hospital, which is frequently awarded as being perhaps the hospital with the best health infrastructure. Okay, so the management of comorbidities and symptoms would come in two areas: the medical management, and Dr. Shweta has spoken about that, and the rehabilitation per se, which is lifestyle management. Now, the amazing thing about lifestyle is that it comprises of very few activities. It comprises basically of nutrition, exercise, and mental well-being. So whether you have a cardiac ailment, whether you have COVID, whether you have diabetes, whether you have hypertension, irrespective of the ailment that you have, you need these three basic pillars of modification of diet, moderate exercise activity, and sufficient rest and relaxation to improve the overall health, improve the immunity, and therefore improve the benefits of rehabilitation for the individual. So rehabilitation would come in two broad areas. One is the management of comorbidities, and the second is the management of symptoms. It could be fatigue, it could be brain fog, it could be body ache, it could be insomnia, it could be any of these things. But broadly speaking, we would divide it into two parts. One is lifestyle change, which would be a broad spectrum activity. And then, of course, you would look at dealing with specific items. Now, let's talk about the lifestyle aspect for a minute. Now, the lifestyle aspect, you're talking about nutrition. Now, obviously, when you talk in terms of managing the COVID client or the COVID patient through nutrition, the very first thing is you have to look at the comorbidities. What were his comorbidities? If it is diabetes or hypertension or cardiac ailments, well then, or even renal kidney ailments, you would obviously need to maintain a therapeutic diet. So that is the first factor that you need to consider, that he needs to maintain and continue a therapeutic diet. The second aspect would be the macro and micronutrients, the flavonoids, the minerals, the vitamins, and so on. And then you have the standard choice between natural and processed food. And we know that processed food damages the body. So we'd go for natural foods such as vegetables and fruits, which are the mainstay of any system. And then, of course, because of malabsorption, you may look at adding supplements. The adding of supplements will be done by your nutritionist or by your doctor, your vitamin A's and vitamin B's and vitamin C's, vitamin C for immunity and so on and so forth, which are so important to strengthen your immunity. Now, the one aspect is nutrition, which adds calories and as a consequence will increase body weight. The second aspect is to utilize those calories appropriately, or to utilize that food appropriately so that it gives the body improved health. And what is the improved health that can come from an exercise system? The benefits are you can increase your stamina, your cardiorespiratory stamina, improve your circulation, increase your lung capacity, improve your muscular strength, improve your joint ability, strengthen your bones, reduce stress. It's profound. It seems to be a single activity that has multiple benefits. So what are the components of an exercise activity? And I'm only looking at a 5-minute exercise program that could be done on a day-to-day basis at home. You need to improve your stamina. You could do walking, jogging, cycling, or swimming outdoors. That is fabulous. Or you could do the same inside your home on a treadmill or an exercise cycle. Not more than 5 minutes. It would increase your cardiorespiratory system, improve your circulation, improve your respiration, strengthen your bones, and so on and so forth. And then you have strength. Remember, 60% of your nutrients go to your muscles. Now, the minute you exercise, you reduce body fat. The minute you reduce body fat, you increase metabolism. The minute you increase metabolism, the entire body benefits. So strength, just 3 or 4 exercises, the upper body strength, the middle body strength, and the lower body strength, and you have it all. And then, of course, every joint of the body, the neck rotation, the shoulder rotation, the wrist rotation, the finger rotation, the waist rotation, the hip rotation. Just keep these joints mobile, and the synovial fluids will improve the entire body structure. Now, one of the major benefits of exercise is in mental well-being. Now, I know that in the mental well-being aspect, I've spoken about stress, anxiety, depression, counseling, support systems, and sleep and relaxation. But I would like to digress from the points made over there by simply saying that you can manage stress and improve mental well-being in 3 areas. One, the physical aspect. And that can come simply from exercise. A 5-minute exercise program is as good as an 8-hour sleeping program. So exercise is a strong component, of course. But if you ask me to go by the book, then I would say that exercise is defined as 30 minutes of exercise activity 5 days a week, or 60 minutes of exercise activity 3 days a week. That's fabulous if you can get to it. But if you cannot get to it, even 5 minutes will strengthen the possibility of you increasing your capacity. So the physical aspects of mental well-being is improved greatly by exercise. And then you have the mental aspects. Sleep is nature's nurse. So therefore, sleep 8 hours a day. And then in the East, we have created several meditative systems. You have the pranayama breathing techniques, you have meditation, the shavasana techniques, and from the Orient, you have Tai Chi. These are fabulous systems of relaxation that can relax the mind. And never forget support systems, the support of your family, the support of your doctor, the support of your lawyer, the support of loved ones. These 3 activities, the physical, the mental, and the social, will greatly reduce stress. Yes. So then we come to the programs that we have. You can see 2 slides for what it's 2 brochures. On the one hand, on my left hand, you have the physical rehabilitation program that is in the RAC hospital today. The physical rehabilitation where you come in, you meet your doctor, you meet your physiotherapist, your nutritionist, and your psychologist. It's just a 2-hour session, and you go back so knowledgeable about how to manage your health in the comfort of your home. And talking about the comfort of your home brings me to the next unique presentation that RAC Hospital has made to the Middle East community, and it's available around the world, which is an online system, an online COVID rehab program, by which all the information and advice that you need in order to remain healthy at the tips of your fingers on your home computer is available. All we need to do is to ask you to fill in your comorbidities, fill in the symptoms that you've had, and boom, you have a beautiful explanation of what you need to do, which we would always advise you to share with your medical professional. Share with your medical professional. This does not replace a prescription. It is for your doctor to support you and mention or approve of the very, very specific systems that our psychologists, our nutritionists, and our physiotherapists have created. Yes. And with that, there's not much more for me to say, except to say thank you. Thank you very much for giving us this opportunity to talk with you today.
Thank you, Professor Kennedy. As usual, a brilliant talk, and you have summarized such a big, vast topic into a space of about 15 minutes, and I think that's a more difficult task than we can anticipate. Hopefully, as the webinars roll out in the coming weeks and months, we will be addressing each of these specific topics in a lot more detail, right? So I can see that we have a number of participants who have been listening to both of you, Dr. Shweta and Professor Kennedy. I am looking to see if there's any questions in the chat box. Dr. Wilku, can you hear me? Are there any questions?
Yes, sir. There are a few questions. I'll be putting on those forward, and meanwhile, those who have any queries, they can put in the chat box. We will answer that. First of all, good morning to everyone. And it's a pleasure that we are launching this webinar series for COVID Beat to help support all the patients who have been suffering from COVID. And since they had many symptoms, like Dr. Shweta and Professor Kennedy has already mentioned, these symptoms may linger up for a while. And we have received a lot of questions, queries. So I'll be putting in a format of FAQs. So because they have put a query in a good text and comment like their own. So first, my first question, one has asked, how long the COVID symptoms will be lasting for even after being negative? And are these common symptoms to all the patients, or it's separate to individuals? I think Dr. Shweta will be the best to answer this.
Thank you, Dr. Wilku, and thank you for asking this question. It is highly variable. For some people, symptoms don't last beyond the 10 days after being negative. For some people, it goes up to 3 months. That is what we have seen, but you can fall anywhere from 10 days until 3 months, or sometimes occasionally beyond. Now, again, as Professor Kennedy mentioned, what has been your physiological state? What was your prior state is very important. Your mental fitness, your physical fitness, what other diseases that you had. All these determine the final outcome in terms of your disease recovery, the time to recovery.
Thank you, Doc. The second question is, can COVID cause a severe disease? Like we always talk about those people who have comorbid status, so they are at high risk. So one has asked, can COVID cause a severe disease?
So I will take the liberty to answer this as well.
Sure.
Yes, COVID itself can cause a severe disease. As we mentioned, that COVID is not just limited to the upper respiratory tract, or so to speak, the upper part of your chest, nose, throat, etc., which is any other flu virus which does that. But COVID essentially gets inside the body and causes blood clotting and other issues with inflammation, which is nothing but release of chemicals which are not good for your organs. And that is the reason why you can have all the complications with the COVID itself. So comorbidity is one thing, but COVID itself causing, for example, brain stroke or heart problems or kidney issues, liver, is part of COVID itself.
Yeah, thank you, ma'am. I think this question will be best for Professor Kennedy. Professor, one has asked, after being positive, I had COVID and it was 2 months back, but still I feel low energy levels. He's asking, can I go for a gym exercise?
Yeah. I can't hear Dr. Wilco. I can't hear him speaking.
Okay, Professor, one has asked, he 2 months back, he had COVID and still he feels low energy levels. So his query is, can I go for a gym exercise?
Thank you, Dr. Wilco. I didn't hear your question the first time. So thank you very much for that. We have an individual who 2 months back was COVID positive, and now is asking whether he can do an exercise program in spite of the fact that he's feeling weak. Yes, you will feel weak, or there is every possibility that you will feel weak during this COVID, post-COVID phase. The standard rule of illness and exercise is that you do not exercise for 2 to 3 weeks after an illness. So if you've had COVID, then obviously you would take a little time to rest and relax and not do any exercise immediately after your illness. That is point one. So I would recommend a 2 or 3 week break post an illness before you get back to exercise. That is the first point. The second point, I am feeling tired. What do I do? It is true that you are feeling tired, and as a consequence, you can do what is known as light exercises. Exercises come into 2 categories, light and moderate, or excessive and competitive. So light exercise programs include things like walking, yoga, tai chi, calisthenics, joint movement, home exercise activity, etc. So light exercise activity can be undertaken by this individual. So we are talking in terms of walking, we are talking in terms of complete rejuvenation by a yoga practitioner, or we are talking in terms of complete joint mobility at home. And this will give you what we refer to as innovation. In exercise, you have 2 benefits. One is the benefit of innovation, which comes with light exercise, and the second is exhaustion, which comes with heavy exercise, which then brings us to the third point. Should I do gym exercise? Now, my assumption here is that this individual is an individual who is young, and therefore you talk about gym exercises. Well, gym exercises can be done by individuals of any age, but my answer to that question is that I would not recommend gym exercises for a period of 3 to 6 months post serious COVID, which means that if you have been hospitalized for COVID, then I would not recommend gym exercises except for a period after 3 months, and then only after you have your doctor's specific approval. Any individual who has to exercise, if he is beyond the age of 35, he or she is beyond the age of 35, needs medical clearance. This is a legal formality. You need to be medically cleared. So you need to get your doctor's medical approval. If you are young and have done gym work before, then I would recommend you may do that. But remember, keep in mind that you use light weights and maximum repetitions. So I would say any exercise load would be half your body weight. Whatever your body weight is, do not increase the weight carrying capacity to beyond half your weight, and be sure that you are able to do 12 to 15 repetitions. If you cannot do 15 repetitions, the exercise is too heavy. So I'll sum it up by simply saying, please get your doctor's medical clearance. I recommend that you do light exercises. Do not do an exercise program till at least a month after COVID. And if you want to do gym, I suppose that you have already experience with gym, but take your doctor's approval.
Thank you, Professor. You have already clearly explained things. The last line was the best line. Individual should take a clearance from his or her doctor so that he can go for a exercise, and what type of exercise they can go. Definitely. And next question, I think, Professor, there are two aspects of this question. Professor, as well as Dr. Shweta, I will request both of you to give your opinions on this. One has asked, after being COVID, so my sleep patterns have changed. I'm not getting sleep, very sound sleep. My sleep is very weak. I get up very fast. So it's disturbed sleep. So please help me out. So I would rather request Dr. Shweta and Professor both to give their opinions in this.
Dr. Shweta, you first, love. You are the neurologist. There is no one better than you to answer this question.
For sure.
And I will take it after you.
Sure. Thank you. Thank you for asking this question. Sleep disturbances are very commonly seen post-COVID. There are very many reasons for it. First of all is the anxiety itself. COVID is coming for the first time in all of our lives. So internally, our minds are very anxious. You know, what will happen to me? Will I recover? Will I not recover? Any sort of anxiety leads you to disruption of sleep itself. Plus, as we said, that COVID is not just limited to the upper respiratory tract, it is going within somewhere into the system and also technically causing issues with the neurotransmitter, etc. However, one good reassurance is that most of these disturbances do get back to normal by about 3 to 6 months. So essentially, it is very important to not be further anxious about it and then go the spiral route of the stress disease or the depression or anxiety stemming out of it. Take some help of short-term, what we call as sleep-inducing pills, if it is very severe, and these are not addictive. So one has to get that off for a short time, 2 to 3 weeks. It's safe to take medically. However, later on, it's just the reset which you will have to work upon, which will work with Professor Kennedy's help. Thank you.
Yeah, I'll just add a few points about sleep hygiene over here. Now, yes, it is not unusual that most of us, or many of us, perhaps all of us, will at some time or the other suffer from sleep disturbances. Standard sleep hygiene requires, one, that you should be reasonably tired before you get to bed. So I would recommend that if at all you have to do or you are capable of exercise, light exercise done during the day would be helpful, but not within 2 hours of going to sleep, because this would make you hypermetabolic and therefore increase your entire body activity. So exercise done in the early evening or during the first part of the day will make you tired, comfortably tired enough to go to sleep. That is one aspect. The second aspect, any meal eaten prior to sleep should be a light meal. It should not be a heavy meal that stays in your stomach through the night. Remember, it takes 4 to 6 hours to digest a meal. So therefore, I would recommend that you have an early evening meal, and the meal should be light. When I say light, I mean it should be half of your lunch, a light meal. Avoid coffee and other stimulants, and that includes alcohol. Avoid stimulants prior to sleep. So please avoid that. Avoid other external stimulants, including the TV or any other such program prior to going to sleep. I strongly recommend when you go to sleep for you to do some breathing activity, some light breathing activity, or some visualization, thoughts of meditation. This also helps you to induce sleep. And finally, do not forget the environment, which means try and have a dark room, try and have a room that gives you comfortable temperature, and try and stay in a room that is quiet. And remember, your target is between 7 to 8 hours sleep during the course of the day. Thank you.
Thank you, Professor. Thank you, Dr. Shweta. Dr. Shweta, I'll be adding one more query into this same question. One gentleman has asked, his wife was positive, COVID positive. Now she is pregnant. She is suffering from sleeplessness issue also. His query is how to recover it. Is there any medical attention to be given, or what should be done actually?
Yes, thank you, Dr. Wilku. I just read it, and I think there was a direct message also. Two things are important to understand. Pregnancy itself is a new milieu altogether for the body. There is a lot of hormonal changes which is happening. There is rearrangement of a lot of metabolic process which is happening. Itself, the estrogen progesterone ratio can cause sleep disturbances for a lot of women. That's number one. And number two is obviously post-COVID December. So it's about 3 months. In the first trimester, we generally avoid taking any sort of pills. So no pills which can, because it can affect the baby or the fetus. So the best advice is what Professor provided. So we have to do everything natural or herbal and try to get to the physical aspects of the sleep. However, it will disappear as the time will go, as the trimester will progress, it should reset again.
Thank you, Dr. Shweta. One more interesting question is there. The person suffered from COVID, and 2 months since she is suffering from heaviness in the chest. Is it necessary to go for a medical intervention to check what it is or what to do?
So thank you.
And she's diabetic also.
Yeah, thank you, Fatma, for asking that. Yes, first of all, thankfully that you've recovered out. That's a gratitude to God for coming out of COVID. If there is tightness of chest, there are many reasons for it. It could be coming from the heart, it could be coming from the lungs, or itself, it could be anxiety. When you're mentally stressed, you can feel this tightness, or it could be related to the muscle fatigue or muscle tiredness. So if it remains beyond a certain period, always get it checked once. There's no harm medically checking that altogether. And the other point is that if you have these symptoms which are escalating or increasing, because over the period of time, it should have a downward course. But however, if it increases, definitely a medical intervention might be necessary. It's always better to be checked. I would leave Professor Kennedy also to answer that question, because I'm sure there would be many such patients whom he has seen post-COVID who will have these lingering symptoms as tightness of chest.
My own understanding of this situation is very simple, that in case you have tightness of chest, you need to see your physician. Your physician will decide what is the causative factor, and if the causative factor allows us to suggest some lifestyle change, we will do that. But I would strongly recommend that the first step is to meet your medical professional to find out the causes of that of the tightness of chest, and we will take it after that.
Thank you, Dr. Shweta. Thank you, Professor Kennedy. One question from Sangha Mitra. How can we avoid second infection of COVID? How to prevent it?
That is a very
interesting.
interesting.
I think Dr. Shweta can answer this.
Yeah, that is a very interesting and ongoing sort of dynamic question. Just one day back, a very important study has been published in a very credible journal called Lancet, which we all respect. And what it has shown, it was a population study from Denmark, and they studied all the people who were positive in the past. The repeat rate of COVID infection has been under 1%. Roughly, they've mentioned about 0.6%. Now, what is happening? Who is getting the repeat COVID infection? Mostly in that large study is above the age of 65. So it's highly unlikely that a young person would get a repeat COVID infection. And all those people who did get a repeat positive were not too much symptomatic, which means they had been detected positive, but there were minimal symptoms. However, this is still would be an ongoing question, and as the time unfolds, we will get more clarity on it, on this. At this stage, pretty much widely speaking, the answer is it is extremely unlikely to get a repeat COVID infection.
Thank you, Dr. Shweta. Dr. Shweta, you are muted. You are muted.
Yes, that's it. That was my answer.
Okay. Thank you, Dr. Shweta. There is one question from Dr. Shweta. You are muted again. Yeah, please say. We didn't hear what you said.
Sorry, I lost the link. Which question are you talking about? The repeat infection? It is extremely.
Yeah, that was, I think, over.
Yeah, but after that, I'm sorry, I did not get. Would you please repeat the question? There is some disturbance.
Yeah, next question is VG Kannan. She has asked, is it a standard outcome that D-dimer increases, and how to prevent it? And does it forms clots in it?
Thanks, VG. We have to understand what is D-dimer. D-dimer is essentially linked to the clot, but also to any infection. We do see D-dimer increasing whenever there is clot in the brain, clot in the heart, clot anywhere, or even otherwise whenever there is any infection. So it is not highly specific to the clot, but generally in all the COVID patients, we do see it elevated. Now, I think you mentioned the value of 2.5, which is very, very low. But the point is, yes, once you come out of the COVID infection, better to recheck all the parameters. And if you are a diabetic, you had a high D-dimer, and one of the odd complications from the COVID, which was linked to heart or to the brain, better to get a complete medical assessment done after about 6 months following your COVID recovery. So do not be anxious about the D-dimer at all. It just goes up and then it sort of comes down and then gets negative. I hope that reassures you and gets you onto the path for the coming 6 months. Thank you.
Thank you, Dr. Shweta. There is one more last question. Okay, there is one more last question. One person, he said, my age is 25 and I am very fit, average weight, and I don't have any family history of any medical disease. And suddenly after being COVID, I was diagnosed that I have elevated blood sugar levels. So my doctor has said not to start any medication as of now. So what should I do? Should I go for a medication or should I do a lifestyle change? What is the suggestion you would give us?
Thank you. See, 25 and diabetes, I would say, please get it properly evaluated. Definitely you need whatever the numbers, because I really don't know the numbers, so I cannot give any medical advice. But essentially, depending on the numbers, you have HbA1c, which is the 3 months glucose. You have the fasting glucose. You have the postprandial, which is 2 hours glucose. You have to see it in multiple forms to understand what could be the next sort of medical care or level. I would suggest meet the diabetologist or the endocrinologist and sort it.
Dr. Wilco, I'll add to that. My understanding is that this young gentleman is 25 years old. He's had COVID and his blood sugar levels are currently high. I'm not aware of the exact numbers. Well, even if you were to go to your physician would certainly recommend lifestyle change as the first step. Your physician might also recommend medication. That is the knowledge that the physician has that he will suggest at this point of time. However, a young 25-year-old whose blood sugar levels are high will greatly benefit from exercise activity. Now, there are specific exercise activities that help in diabetes. Any activity that is highly metabolic, jogging instead of walking. Now, this young boy is 25 years old. So any type of activity that is anaerobic, meaning that if you were to run short distances and walk for recovery, that will utilize large amounts of sugar from the bloodstream. So that is a good activity. Intense exercise activity is good. In this instance, I would suggest a half hour of stamina-related exercise activity, such as jogging. Now, you don't have to run the entire distance. You could jog 100 meters, walk 100 meters, jog 100 meters, walk 100 meters, push your heart rate up to about 130 or 140 heartbeats. You're a young boy, 140 heartbeats is nothing for you to be afraid of. You can bring it back to normal recovery by doing 10 repetitions of deep breathing. But remember, if you are diabetic, then I would give you 2 or 3 bits of advice. One, the exercise activity has to be intensive. Jogging is good. Jog walk is good. Half an hour in the morning is excellent. If you wish to do for half an hour in the evening, please go right ahead. That is step number 1. Step number 2, your dietary modifications. Avoid simple sugars. Stay with complex carbohydrates, which means avoid bread, avoid rice, avoid anything that comes from wheat, avoid these things, maize, anything that creates starch. But take your carbohydrates from fruit and vegetable, especially leafy vegetables. This will give you high bulk, it'll give you high fiber, it will give you low calories. So that is a good activity. Avoid fruit juices, avoid commercial foods. That is from the aspect of your diet. Keep your diet with a protein at about 1 gram per kg of body weight. That would be good for you. Make sure that you have fruit and vegetable on a daily basis. For the early phases, please reduce your intake of simple sugars. That would be table sugar, as well as rice, wheat, bread, and so on and so forth. And then we come to the third aspect, and that is the mind aspect. I would recommend that you please undergo some form of relaxation. Remember that any type of stress tends to increase the activity within the human body, the adrenaline and all these other aspects, which has its own impact on your sugar. So therefore, sleep is another good aspect that I would suggest, sleep and relaxation. These simple lifestyle measures, I believe, will bring you back to the best way to support the medication that your doctor might provide.
Yeah, thank you, Professor. I think the questions have, there is no more questions, but I would suggest everyone, those who have registered, because now see, this webinar series is going to be every 15 days. We will be picking up medical components as well as the lifestyle components to explain whatever the sufferings are. My suggestion will be, as you have registered, there is a COVID rehab scan in the website. You have already registered for it. Please do fill your information, whatever, it's a self-explanatory scan. After doing it, you will get a prescription, which will tell you about your comorbid relation with the symptoms and what is the lifestyle intervention to it. It gives you self-explanatory prescription. Read this, this will help you out. If you have more queries, you can post queries. We will support as much as we can. Thank you so much.
Thank you, Dr. Wilku. And I think this has been a wonderful session for the last hour or so. Being the first in the series, I'm actually very excited about the further sessions. I think what I understood from what we have seen is the question answer session is probably more important from the participants' point of view. And we will try our best to make sure that we have enough time on each session for question and answers. And as Dr. Wilku said, if there are more questions, that can be done interactively on the website itself. Look, I know we have been going at it for the last 60, 70 minutes. COVID has, well, in December 19, we did not know about COVID. I think in the last year, 15 months, this has changed our life so much, you know, at home, at workplace, for us, for the school kids, for travel, you know, airports, restaurants, wherever you go, there's a new way of living. There's a new way of interacting. There's social distancing, there is masks. And I think this is important to remember that this preventive measures are very important for the foreseeable futures. The fact that we cannot visit our family and friends as often as we used to do, it's going to have a huge impact on human psychology and human behavior. And this is done for everybody for our own good. And I think we have to respect the social distancing norms, the preventive norms, not just to prevent second infections, but of course to prevent the first infections. We have learned a big lesson. I know we always talk about this, that prevention is better than treatment and cure, but COVID has brought it to the fore and said, look, prevention is so much better than cure and treatment. And I think our behavior, our day-to-day life has changed so much. There are, of course, the tools to fight COVID is the vaccination. I think it cannot be emphasized how much vaccination is important. And for those of us who have overcome the illness itself and have recovered, and it is important to be aware that 3 months later you might still need to be vaccinated. And certainly for your friends and family and other people, just pass on the message that vaccination is the best way to fight this together. And of course, Professor has highlighted the lifestyle challenges that we all face. It's important. It's important to have a healthy lifestyle to reduce so many illnesses. So many illnesses. At least there are very few illnesses that we cannot prevent entirely. Uh, Exercise, diet, stress management, taking care of the fact that we have to adopt healthy lifestyles, not smoke, reduce alcohol to as little as possible, and in chronic disease management. Thank you, Dr. Wilku. Thank you, Dr. Shweta, and thank you, Professor Kennedy, for your wonderful talks. And I thank every participant who has taken their time out on the Saturday morning to make this webinar a success. I think I mean, from just listening to all of you interact and talk has been a wonderful experience. And I look forward to the next one in 2 weeks' time.
Thank you.
Thank you. Stay safe, everyone.
Stay safe and take care. Bye, everyone.